Barbara was hit as a pedestrian by a motor vehicle, and she sustained severe traumatic brain injury, as well as severe injuries to her left ankle and foot. My name is Dr. Sharon Kawai. I'm licensed by the state of California to practice medicine, and I'm board certified in physical medicine and rehabilitation. I treat patients who have sustained traumatic brain injury, spinal cord injury, multiple fractures, and chronic pain syndrome. Barbara will require 24-hour care now and for the rest of her life, secondary to her severe traumatic brain injury and the cognitive impairment. She has issues and she doesn't know how to problem solve. If there was a fire, she wouldn't even know to leave the house.
She's really scared of walking. She's scared. Sometimes she'll be sitting down and she'll say, you know, I'm falling. But she's really sitting down. She goes, I'm going to fall, I'm going to fall, I'm going to fall. And she's just sitting down on the bed. She has a fear of standing. She has a fear of moving around.
The injuries to her left ankle and foot have resulted in chronic severe deformity and chronic pain, which makes it impossible for her to bear weight on that left ankle and foot.
She cannot walk. She cannot stand by herself because of her left leg. It's inverted.
Que no puedo moverme, que tengo que estar en la cama, o tengo que estar tranquilo, que no puedo salir con ellos a pasear, que no le puedo hacer nada, que estoy, como quien dice, incapacitada. Mi vida sin ellos no tiene significado.
She lost her independence after the accident, and she's not the same person.
Currently, because of the deformity and the severe pain she experiences in her left ankle and foot, it's made it difficult for her to be able to even stand on that left leg. She is staying in the upstairs. It's the only place where they have bedrooms and a bathroom. She had to scoot down the stairs on her bottom in order to come down.
She can feed herself, you know, slow, but she can't cook for herself. She can't walk around the house by herself. She can't even get out of bed by herself. She needs some assistance.
Prior to being hit by the motor vehicle, she was independent in her walking. She required no assistive device at all. She was independent in dressing herself and in doing homemaking activities. So she was totally independent and pain-free. She has severe short-term memory impairment.
Because of the head injury, the doctor said the Parkinson's progressed even more. So she's not able to grasp things and sit up.
Barbara will be able to make some improvements, I think, with better pain management, but she will always require some physical assistance in her activities of daily living. She'll always require someone to administer her medications, most significantly because of the severe traumatic injury and cognitive deficits that she has.
Eso no tiene descripción. Es horrible el dolor. Horrible la posición. Cada vez se va poniendo más mala. ¿Cree que esta posición pueda tener? Es muy doloroso para mí. Muy doloroso. El dolor es tan fuerte que acaba con la vida mía. Este hombre acabó con mi vida y la de mi familia.
She struggles that she knows that because she knows how she used to be before the accident and how she is now. She knows that she's not able to be independent as she was before the accident. She knows she can't walk, even though she wants to, but she can't.
Barbara's physical limitations are secondary to the severe traumatic brain injury, which has left her with impairment in her balance. It's left to her poor safety judgment.
She's, you know, really depressed, you know, and she cries a lot, you know, because she knows that she was a different person before the accident, and now after the accident she knows that she's not able to do things for herself, and it's really sad.
At this point, she's really requiring the assistance that a 3-year-old child would require. Physical assistance with her bathing, physical assistance with dressing, physical assistance just getting in and out of the wheelchair. So basically, it's like caring for a 3-year-old, and also with the temperament of a 3-year-old, someone who's not able to always cooperate because of her feelings of anxiety, depression, and mood swings and irritability.
She's not well, where times she says a lot of things that are inappropriate, you know, and I feel bad because these are things that she doesn't know that she's doing.
Unfortunately, because of her mood swings, where she becomes anxious and depressed, and at times irritable with the family members who've tried to care for her, it makes caring for someone like Barbara more difficult. So it's not only the physical assistance that the family member has to provide to her, but it's also the personality changes that we see in her, and the behavior changes, the emotional changes that occur with a severe traumatic brain injury. So that's why I'm recommending the LVN and CNA care, so that there's a little distance between the patient who's being cared for and the professional nurse who's there to provide the care. Because usually this works out better for the patient, and it's easier for them to apply the behavioral management techniques that will be taught to them by the psychologist, who I'm also recommending for Barbara.
Yo soy tan diferente antes que no me conozco. Es horrible. El dolor es horrible. Y mi vida ha cambiado totalmente.
In my clinical experience and expertise, I think Barbara will always be totally dependent on a caregiver for safety in her environment, someone to drive her to and from locations such as doctor appointments, therapies, and also just to get her out and about in the community. Basically, she could enjoy something simple like a sunset again.
I miss the way she was before the accident. She smiled a lot. You know, even though in spite of everything, you know, that, you know, a person goes through in life, she always carried a smile.
The life care plan that I'm recommending, we can improve the quality of her life and her longevity for as long as possible.